demonstration, I really wanted to show you guys something that you might not have any experience with. Some of you may have some experience with a chiropractor's office, and others of you might be looking at this table and have absolutely no idea what it is. So what I'm going to show you is actually how to use a chiropractic adjustment table. I'm not a chiropractor, however, I've worked at a chiropractor's office for about a year now. So pretty much what I'm doing all day, every day is adjusting this table to fit our patient's specific body needs. We get new patients in here all the time, and they're super intimidated to get on this table, and I completely understand why. However, this is called an adjustment table for a reason. Anything on this table is designed to make you more comfortable, especially if you have really bad problem areas. This can help alleviate a lot of the pressure in those areas. So I guess I'll start by showing you our most basic adjustment, which is pretty much what I do every day, is the simple adjustments to the table. We start by using this hip piece here. Both of these pieces actually move up and down. This is used to match the patient's height. So we start with the hip piece, and this is exactly how it sounds. We raise it to match the height of the person's hips. So I'm pretty tall, so I'll put this about right here. There is a little knob on the side here, and that kind of helps lock this into place. Then we do the top pad. Like I said, this moves up and down. We like to keep this top pad about an inch or two away from the bottom pad, and that's usually a good spot for the patient to lay face first, and then their face goes into the facial pad right here. And then there's a knob right here that locks this one into place also. So like I said, this is designed so that the patient can get on face first. That's how we adjust the table initially, is always having the patient face first. Usually at some point in the adjustment, the chiropractor will have you flip onto your back, but we always adjust the table to have the patient face first. Like I said, that is the most basic adjustment, is just to the height. However, we do have a few more adjustments we can do to the table. Like I said, if you have more problem areas. For example, we have the head pillow here, which helps with patients that might have really bad neck pain. We even get some patients that have a little bit of roundness in the neck, and it can be pretty uncomfortable to lay completely flat on a table. So there's a lever over here that you just push down, and that pushes the neck piece all the way down like that. And we usually wait till the patient is laying flat on the table once we put the table down, and that kind of gives the patient a better idea of what's going to be the most comfortable for them. Bring that back up. Another adjustment that we can do is to the hip piece here. Especially for our elderly patients, they get a lot of pressure in their hips. A lot of their hips are even off a little bit, and it can be really hard to lay flat on a table for 10 or more minutes. So there is a knob over here that, if you just crank to the right, pulls this piece out a little bit, and that alleviates the pressure that they're going to feel in their hips. We even get some of the patients, I'm sure you've seen before, they have really bad curvature in their spine, kind of a little bit of a hunch like that. So this pad actually pulls out like so. And as you can see, it kind of matches the curvature of the spine. So typically we would have the patient lay down, and that way we get a better idea of how to match their spine, and that makes it a great deal more comfortable for them to lay flat. I'm going to bring this down. This hip piece is also used a ton for our pregnant patients. A lot of people don't realize that you can be adjusted when you're pregnant, really even up until your 9th month. As long as you're cleared by your OB, which 99% of the time they will agree that it's really healthy for you to be adjusted as well. So we adjust this hip piece not to their hips, but to right below their belly area. So I move this down just a tad, and then you crank that piece out a little bit, like I said, to alleviate the pressure in the hips. And then this belly piece takes a little bit of muscle, so bear with me. And then that piece right there pushes all the way in, which obviously helps our women that are up into their 2nd and 3rd trimesters. Usually usually when they're still in their first trimester, we can get away with just using the hip crank there, and that kind of gives them a little bit more belly room. But obviously our women that have full bellies, it's not safe to have them laying flat on the table like that, so this belly piece gets pushed all the way in. Our last adjustment is actually done when the table is brought all the way down, so I'll show you how to do that. This table is really nice because it's on hydraulic shocks, so all I have to do is just press this electric pedal and it brings the table down by itself, which is really nice. Alright, so we have another adjustment on the table here, which would be the ankle bar. If you just pull up on the ankle bar here, that creates a little bit of a bend in the patient's knee, which can be really good for people that may have problems with their hips, knees, and ankles. Imagine laying and it kind of feels like you may be hyperextending your knee, which could be really uncomfortable. Pulling this ankle bar up creates a little bit of a bend in the knee and makes it a little bit more comfortable to lay flat on your stomach like that. So like I said, that is pretty much your basic adjustment on a chiropractic table. So hopefully if you have to go for your first visit or another visit, it might not be so intimidating for you.